So it's such a special opportunity for me to get to sit down and speak about migraine with you, Dr. Starling, not only for all of those people who can benefit from this information, but because I too live with migraine and have my entire life.
Well, I have migraine as well, and there are times that I am dealing with frequent attacks. So it's great to have a conversation where we can actually share ideas.
I'd be so curious to know some of the most important ways that you manage your migraine condition.
Yeah, so I do my best to go by these 7 principles of managing migraine for myself. And these include keeping a routine, exercising regularly, limiting caffeine, treating attacks as early as possible, having a low threshold for prevention, and then not playing the trigger game. And finally, acceptance. These are the 7 principles that I try to use to manage living with migraine.
That's wonderful. So let's start with what I believe you mentioned first, routine.
Yes, so one of the biggest triggers in migraine and migraine attacks is any type of change and a change in routine. So I try to limit that as much as possible. Trying to go to sleep around the same time, waking up around the same time, regardless if it's a weekday or a weekend. Trying not to skip meals, trying to stay really well hydrated. Keeping that schedule can be really helpful in preventing migraine attacks.
Thinking about that sleep schedule, not taking advantage of times to sleep in, and really challenging myself to go to bed at earlier, more appropriate routine times has been a real learning curve for me. Ideally, I would also like to have more routine with things like meditation and mindfulness, as well as focuses on exercise, hydration, and good nutrition as well.
So that mindfulness and meditation can be really helpful for stress. And I also find that exercise can be helpful for stress management as well. In addition, there are actually migraine prevention studies that have demonstrated that exercise, 20 to 30 minutes, 3 to 4 times a week, can be just as effective as some of our prescription medications. So I do my best to initiate exercise several times a week. And that doesn't mean you have to go to the gym and have this intense workout. It could be a brisk walk around the neighborhood with your kids, or swimming in the pool, or riding a bike. Just something that gets your heart rate into your target range.
I think the idea of exercise, when we think of it as something very intense, can be very overwhelming when you're living with migraine, certainly at high frequency. But to understand that that can be something that takes on a gentler form and still fit in and bring some benefits for those times that more robust exercise isn't possible is encouraging.
Yeah, 100%, especially when someone is having migraine attacks frequently, they're always in some sort of pain or on the verge of having an attack. And so they're worried about intense exercise. But actually swimming, recumbent bike can really be gentle forms of exercise, gets your heart rate up, meets those requirements for aerobic exercise, but doesn't trigger an attack.
So we've talked about, of your 7, routine and exercise. You also mentioned limiting caffeine.
Yes, so for me, I usually try to keep my caffeine intake at 1 beverage or less. And whatever I'm doing, it's really important to actually be pretty consistent. So if I'm in a rhythm of drinking 1 caffeinated beverage daily, I need to actually keep with that, because caffeine withdrawal headache can also be something that triggers a migraine attack. So caffeine daily in moderation, not more than that, but not less than that, is what works for me.
So I've always been fairly wary of caffeine, having lived with migraine for so long, and also probably having a pretty intense reaction, it seems, to caffeine. I've heard some people talk about trying caffeine at their perceived early stages of a migraine attack to see if that could thwart the attack.
Yeah, there are some patients that find that caffeine can be effective as an acute treatment option, something to stop the attack. And there are studies that have demonstrated that caffeine, especially when combined with a medication over the counter like acetaminophen or ibuprofen or naproxen, can actually be helpful to treat a migraine attack, more effective than even the analgesic medication itself.
Wow.
However, there are other studies that demonstrate that if people with migraine have an intake of more than 200 milligrams of caffeine, which is like 2 strong cups of coffee, if they have more than that, it actually can lead to disease progression and increased burden of migraine, where people start having more frequent attacks or start having those caffeine withdrawal headaches. So I think caffeine is potentially a treatment, can potentially be a trigger for some people. But if people are using it, use it in moderation and use it consistently and try to stay below that 2 cups of coffee or caffeinated beverages daily.
What's next?
So next is treating an attack early, treating it as soon as you feel the attack is coming on. And for me, that means I have to have my acute treatment medication everywhere. In my car, in my husband's car, at my house, at work, in my bag over there, all over the place. Also on my bedside table, so that when I'm having an attack, I have the medication right there. I can take it right when I feel the symptoms coming on.
Me too. I have it in so many different places and then need to remind myself to check expiration dates in different places. But there really is something, for instance, those middle of the night attacks, about having the medication bedside versus having to get up for it. It seems to make a big difference.
For sure.
This also really highlights the importance of being aware of those premonitory signs or prodrome. For me, that's changed over the course of my life. Now it can include things like sudden fatigue or irritability, mood changes of some sort, or things like yawning or difficulty finding words. What do you notice in those very early stages to help you treat early?
Yeah, looking back, I do have premonitory symptoms. I get some of that neck stiffness. I get some of that sensitivity to light. All of a sudden, I'm kind of squinting. Sometimes I'll even get frequent yawning. But to be perfectly honest, I'm typically not very aware when those symptoms happen. It's only in retrospect that I'm like, oh yeah, I was about to get a migraine attack. But I have become more aware of right when the pain starts. So that mild level of pain. And that's when I'm kind of rushing to get my medication and take it, because I do know that that is when the medication is more effective. And that is when I can stop the attack without it progressing to getting nauseous and vomiting and all of those other symptoms.
I most often am not aware of the attack in progress until some pain has started. But if I do catch wind of one of those premonitory signs, sometimes it can help me be more on alert to watch for those earliest signs of pain, to think about early treatment.
Yeah, for sure. And then also, you can start trying to do things to try to manage that attack. You can turn down the lights, get in a room where you could rest, have your medication ready, and just kind of prepare. So it would be great if I could teach myself to have greater awareness of those premonitory symptoms. But, living with migraine is a work in progress.
No, that's for sure. You also mentioned having a low threshold for migraine prevention.
I always try to keep a very low threshold for starting migraine prevention for myself. So if I start noticing that there's an increased frequency in attacks, if I'm having more than 1 attack per week or more than 4 attacks per month, I consider initiating a preventive treatment option. Because 2 things. One is, starting a preventive treatment option is not a life sentence. I don't have to stay on it forever. But if I can reduce the frequency of attacks, reduce the duration and the severity of the individual attacks, and make them more amenable to acute treatment, it's going to reduce my burden of migraine disease. So I initiate preventive treatment options, and I'll usually use it for about 6 to 12 months. And around that time, I'll evaluate if my migraine attack frequency has decreased, and if so, I can consider weaning that medication. Maybe I don't need it any longer. Maybe I need it for another 6 to 12 months. but it's really important to have that low threshold for starting prevention to prevent disease progression and developing chronic migraine.
Well, I think that is absolutely fascinating because I know the idea of initiating migraine prevention can be really daunting to a lot of people, and that's including me. So to hear you talk about the idea that it doesn't need to be permanent, that it can be something that you trial for a period of time with a goal in mind, is really something that feels like it could open the door for a lot of people in consideration, especially when you talk too about the benefits not only of attempting to prevent some attacks, but also the impact it can have on improving, if you will, the attacks that are going to happen anyway, lessening the severity or duration, as well as developing a more significant disease in chronic migraine.
Yeah, a lot of times people don't want to start prevention because they don't want to take a lot of medications. But interestingly, when an effective treatment option is initiated for prevention, you're actually using less medications because you're not having to use as many acute medications. So that is also helpful for patients. But again, that's in retrospect. I think moving forward, I usually tell patients, like, you have migraine every day. Right now, it's very active. We need to try to suppress and manage the underlying disease. And then we can better address those individual attacks.
So this ties in also to the idea of migraine as a threshold disease and what we can do through prevention of attempting to raise our threshold. So all of those different things that can potentially trigger this condition we have are rendered less powerful.
Exactly. Those migraine preventive treatment options are things that will raise that threshold and make it less likely that triggers will result in an attack. Super important to try to raise that threshold because sometimes you can't just manage all those triggers and life just has to happen. We can raise the threshold with preventive options so that you can live your life with migraine.
So you also mentioned, and I love how you worded this, stop playing the trigger game. What does that mean for you?
Yes, so when I get a migraine attack, especially in the past, my first questions that are running through my head is, what did I do? What did I eat? What did I not eat? Did I drink enough water? What happened? All of these questions, when the answer is just, you didn't do anything, you have migraine, let's just treat it. And for me, I don't have any obvious triggers. For me, it's really about not blaming myself for having migraine attacks. It's not a character flaw, but treating the attacks when they occur and treating the underlying disease with prevention when needed. So stop playing the trigger game. It was a really important message and mantra to me that I would have to repeat. And I'd get it and I'd have all these questions and I'd have to be like, stop, you have migraine, just treat it.
Well, that is so beautifully said because that can be a dog chasing its tail, right? Looking for those triggers that may or may not have played a role and can also pull in self-blame and move us away from a focus on doing what we need to do to treat a condition that we have that rears its head.
Exactly.
Sure. Finally, you mentioned as one of your top ways of managing your migraine is acceptance.
Yes, I accept that I have a chronic neurologic disease. I have migraine. It is something that fluctuates over my lifetime. Sometimes I'll have more frequent attacks. Sometimes I have less frequent attacks. But I will have migraine attacks that I will need to treat, and sometimes when I would need to be on a preventive option. I remind myself migraine is a genetic disease. It has environmental factors, it has internal factors, but at the end of the day, it is not my fault. I also have to accept that I am not a robot, that I am a human. And sometimes I drink too much caffeine, sometimes I end up not getting the best sleep, sometimes I end up skipping a meal when I'm at work and I'm busy. And even though I try to do all the right things, it doesn't always happen, and that's okay. I'm working towards all of those goals as much as possible, but really trying to stay away from that guilt and self-blame that is really compounding the burden of migraine.
I so appreciate that you are sharing your perspective on this. Acceptance is a work in progress, definitely for me with migraine, despite how long, I've lived with it. And I think I've made great strides in certainly limiting any kind of negative self-talk during attacks, as I start to feel or think certain ways, and to be able to say to myself, no, this isn't you. This is migraine talking right now. And I also like what you sort of allude to here in really courage. I think about the people in my life, my friends, my colleagues who live with migraine or other chronic conditions, and they are some of the most courageous people that I know, whether they can see that about themselves or not. So being able to accept this, not blame ourselves, and recognize we're not perfect. We know some of the things we need to do, but migraine is still there and going to reveal itself regardless.
100%. And sometimes when you have an attack, you need to rest and you need to give your mind and body time to recover. And that, again, is not a sign of weakness or a character flaw. But honestly, just like you said, that is a courageous step in managing migraine. And I completely agree with you that people with migraine are warriors. They are absolutely some of the strongest people that I know.
Well, thank you so much. I appreciate you opening up about living your own life with migraine as a patient versus a provider alone, and what that means to you. Thank you for being here and sharing that.
You're very welcome. It was very fun to share our authentic experiences about migraine.